Dr. Joel Duah Afi is a medical professional who is leveraging his connections from the fellowship to improve healthcare for all. As the medical superintendent of Asunafo South District Hospital in Ghana, Joel is applying the lessons he's learned during the 2019 Mandela Washington Fellowship for Young African Leaders. The fellowship is the flagship program of the Young African Leaders Initiative, or YALI, funded by the U.S. Department of State.
Joel has been an active alumnus who inspires us all with his work as a medical doctor and health educator. We commend his work mobilizing health resources and transforming rural communities.
During his leadership in Civic Engagement Institute at Drexel University, Joel enhanced his leadership skills, which he applies in leading the administrative and clinical work of the hospital. His professional development experience at the Maricopa County Department of Public Health in Arizona prepared him with the skills to prioritize public health and preventative medicine. He built on the lessons he's learned during his PDE to develop a public health emergency response plan in his community during the height of the COVID-19 pandemic. Joel secured funding through a U.S. African Development Foundation grant to establish a community clinic in Nkuranza, a rural village lacking access to healthcare services for years. Since opening, the clinic has provided medical care for over 30,000 individuals who otherwise would have had to travel over several miles for treatment. Additionally, Joel was awarded a Citizen Diplomacy Action Fund grant to provide psychiatric rehabilitation and vocational skills training for 100 unemployed women to help them establish their own business and achieve financial independence.
Dr. Afi epitomizes servant leaders through his national and international interactions with healthcare practitioners and allies. His commitment to rural communities, family medicine is undeniable, and he has impacted the delivery of healthcare in rural communities in ways that are sustainable and long-lasting.
In 2021, Joel partnered on a reciprocal exchange with Michelle Lawson and Keisha Lawson Elder, who he met through his fellowship. Through their project, the team created gardens to promote meditation, rejuvenation, self-care, and nutrition among hospital staff and patients. The team also provided training for nursing and midwifery clinicians in neonatal resuscitation, preparing them to care for newborns.
Joel's dedication to improving the health of the rural communities in Ghana, West Africa, is nothing short of remarkable. Joel's impact on students, healthcare practitioners, teammates, patients, and the community at large is indelible. I have no doubt that Joel will continue to grow and make a difference in the lives of those he serves. We are so honored to have worked alongside him.
Since completing his fellowship, Joel has helped provide clean drinking water to over 7,500 people and launched a mobile clinic and telemedicine services that have impacted over 20,000 lives through a collaboration with the Hope for Ghana Foundation. Additionally, he has continued to work with faculty and global health students from Drexel University who visit his community clinic to learn more about his sustainable healthcare model. Additionally, Joel has actively served as an ambassador for the program and mentored prospective fellowship applicants. He also served as president of the Mandela Washington Fellowship Alumni Association of Ghana, where he facilitated networking between alumni and new fellows.